All right, after your back, you have an acute back flare-up. First, you want to start off with just getting your core to engage, because that's going to support your spine, like a core set of your spine. The transverse abdominis is the muscle I'm talking about. So it's kind of like drawing your belly button in towards your spine. You're tightening up your stomach muscles like someone's about to punch you in the stomach. Don't really punch somebody in the stomach, but tighten up your stomach muscles. You're not sinking in, you're not pushing out, and you should be able to talk, you should be able to breathe while it's engaged. You can even test yourself by palpating, touching the side of your stomach, and you should feel those muscles tighten up right under your fingers. So start with just doing that, getting used to it, and then you want to start adding in some movement. And what that's going to do is that's going to retell your brain to, hey, support my spine while I'm doing things like walking around, moving to get out of bed, getting out of the chair. And that's going to reduce your pain when you get that grabbing pain when you try to do some movement. So Adam, go ahead and demonstrate now doing some marching with that. So you're going to bring your feet up and down one at a time. Perfect. Now he's doing it nice and controlled. He's not arching his back, and he's engaging those abdominal muscles. And this is going to help teach your back to be engaged and support your spine when you're walking around. Now we're going to add in the dead bug. So now we're adding in some arm movements with it. Arms straight up, arms going to follow the knee. Again, making sure that you can do this without your back arching is key. Perfect. Go ahead and take a rest. Motion's lotion when it comes to back pain. You don't want to rest. The body likes to move. So you need to teach it normal movement again, but you need to teach it that it's not a dangerous environment. There's no need for your back muscles to flare up. So you need to ease into movements to just tell it, hey, calm down, everything's good. So we're going to start with lower trunk rotation. So he's in this nice comfortable posture, and he's just going to gently drop his knees side to side. And what he's doing is he's going to ease into the movement. As you kind of play with the pain, as you realize that pain is loosening up and it's letting you move a little bit more, then you can get a little bit more aggressive, a little further with the movement. Perfect. And again, that's just teaching your body, hey, I can start doing turning motions and things like that without it spasming up and grabbing. Now let's go ahead and stretch things out. Everything around your hips and your low backs. Low back gets really tight after you have a flare-up of back pain because the muscles spasm trying to support it. So we need to loosen them up. So go ahead and cross your foot over your knee, and then you're going to reach through, and that's going to give a good stretch. He's stretching his right gluteal muscle right now. Good. And if you can, try and relax your head when you do it so you're not straining your neck. Good. And make sure to do both sides. You want to hold it for about 30 seconds. Now we'll hit the hamstrings while we're here. So straighten one leg and then straighten this one. And you're just going to grab behind the knee and stretching it, bringing it in. Perfect. Now while you're here, I'm going to show you sciatic nerve glides. So you can go ahead and bring that knee back up like you're doing a hamstring stretch. So bring that back up. Hold on to it. Good. Have a little bend in your knee though. And now as you start to feel that little pull back there, you want to see if you have any nerve tension with it. And so you're going to bring your toes towards you. And if that makes it worse, then it's nerve tension. So flex it away. And if that alleviates it, again, that just tells you it's nerve tension. So doing some nerve glides can also help if you have any pain radiating down your leg. Perfect. Okay. So now let's have you go ahead and get into the half kneel position. And we want to stretch the front of the hip. If those hip flexors are tight, it can pull you into that forward posture. It can also get tight from sitting for a long time. So go ahead and get one foot up at them. Good. And you're going to tuck your butt under, pushing your hips forward, and you should feel a stretch right on the front of the hips. Again, these attach to your lower lumbar vertebrae and disc from the front, and they get tight and pull on your back when you sit for prolonged periods. So if you've been in a car for a long time, sitting at a desk for a long time, these can get really tight and cause some back pain. So again, he's just tucking his butt under, really pushing his hip forward. You can even reach up and over to get it a little bit more. Reach that up, right arm up for me. Good, all the way up. Good, perfect. Good. All right, now you're going to get down onto your hands and knees. And we're going to do cat-cow to loosen up that back. So you're going to sink in and then round out the back like a scared cat. Sink in and round out the back like a scared cat. Perfect. And then you're going to go and hold it in neutral for me. So not scared cat, but right neutral. So come up a little bit more. You're going to engage those abs so they're nice and tight. And he's going to extend his right leg out and his left arm out without arching his back. Good. You're going to hold that nice and tight. Make a nice tight fist. So you're engaging all the way down to the lat. And this leg doesn't have to come up too high because you don't want to extend through your back. Good. You're going to hold it for about 10 seconds. Come back. Good. And do that same side 5 times. Let's do the other side though, Adam, to show them that. So lead with the heel. Right arm comes up. Nice tight fist. So you're engaging the lats. Don't forget to engage the core. And make sure you're not rotating your pelvis. Good. Come on back. Perfect.